One major problem related to child abuse and neglect that stood out to me is the foster care crisis on runaways. The number of children who run from foster care tends to be increasing due to lack of proper care. The foster care system has failed in three specific areas: abuse and foster care placement, the lasting impact on that maltreatment, and poor academic achievement on part of their clients. However, not always achieved, the goal of foster care is to provide children with proper treatment and safety. Failure to do so is directly related to the increasing number of youth who run from care. According to Segaro's article on mental health diagnosis, foster care is meant to be a temporary intervention that creates a haven for children who have been abused or neglected. Foster parents tend to put on a good show when a caseworker is present. Although children may be abused behind closed doors, these parents pretend to care for the child when need be. This creates distorted views of love and care, angering the youth enough to make them run away from care. Most children in foster care seek safety within their substitute home, yet have a hard time finding it. This causes the child to lack trust, especially with their caseworker. Abuse within a foster home causes a lasting impact on the youth affected, such as mental illness and behavioral problems. This lasting impact tends to increase the chances of youth who run or cause them to become chronic runners. Chronic running is when youth run away 3 or more times. According to the article, Seeking Safety, Finding Abuse, in 2009, 36% of foster care runaways were considered chronic. When children run from care, they leave behind a fair chance for education. One duty of a foster parent is to enroll your child in school and make sure they attend. When one runs away, they lose that opportunity. This causes them to lack basic skills such as grammar and proper manners, which can set them back for life. The article, Seeking Safety, Finding Abuse, states that experiencing abuse in the early years can cause the brain to remain in a mode of heightened sensitivity, in which a child can respond to situations in an agitated manner. This act of anger and poor behavior is another reason these children lack a good education. Any child who demonstrates bad behavior in school may be subject to suspension or expulsion. And foster children are at a higher risk than most, with a 24% suspicion rate compared to 7%. Over 40% of foster youth have at least one psychiatric disorder, and nearly half of these disorders go untreated. Scazzaro agrees that meeting the mental health needs of children in foster care is extremely important due to the circumstances that have led them there. Children in foster care often suffer common mental health issues such as depression, anxiety, and bipolar disorder, as well as more severe and traumatic disorders such as schizophrenia. Most runners are found to be females between the ages of 15 to 17 years old. It was surveyed in an article called Running from Foster Care: What We Know and What We Do that over 25% of youth found in runaway shelters came directly from a foster home or group home. 38% of the youth surveyed had been in foster care at some time during the year prior to running. Because youth may perceive the caregivers and their new environment as negative, they seek running as an escape mechanism. They may be angered by the new rules and restrictions placed on them and therefore feel a sense of freedom when running from the designated home. To these youth, running away may allow for time with his or her significant other or a chance to smoke a forbidden cigarette. Youth oftentimes run to family, friends, and freedom and away from rules, abuse, or a negative environment. Crossland informs us that activities that these youth may run to include sex, drugs, and alcohol. Youth who run from care are often exposed to drugs, STDs, and gang involvement. To you and I, it seems like the consequences of running are far worse than not. But to youth in foster care, being in a foster home with new rules, little freedom, and maltreatment weighs far more than street exposure. Upon their return from running, youth will receive stricter, more firm rules such as an earlier curfew or a stricter placement.